Okay, as in any other infection, pneumonia, one of the best things that as nurses we can do is to prevent pneumonia. Of course, pneumonia will could infect anybody, but there are some people who are at higher risk or highest risk, and this should be the target. So we talked earlier about these kind of people who they lost their um, defense mechanisms or their immunity is low. So, for example, for aging, for somebody who's aging, one of the recommendations that we can make is always to give them the vaccination for pneumonia. This is good. It should be given every 5 years. Good for 5 years, of course, and unless it's contraindicated. But pneumococcal vaccinations, it's recommended for everybody who's older than 65 years or to receive it every 5 years. Especially, this become very important for somebody who's COPD and or anybody has other pulmonary diseases. Then become their risk become even higher and higher. So the vaccines will become highly recommended, or for somebody who's frequently gets the pneumonia. The other group would say that the patients with altered level of consciousness, especially if they're intoxicated or after receiving anesthesia or medication or any kind of sedative. Always, if you ever receive a patient who had altered level of consciousness, before you can resume food or drinks, you must test the gag reflex. That's crucial. As whether they are post-op minor procedure or major procedure, or they've been sleeping or sedated for some times, before you start resume medication. That's a safety procedure to do. Their gag reflex should be active, it should be back, and that's when you know that they're ready to eat. Plus, of course, other kind of assessment, but this is as far as aspiration. The NG feeding is very important. You're going to learn about that soon. Imagine the patient is eating 24/7, especially if we have a continuous infusion of formulas. Always, the patient should be upright position. You always must check the residual. If the residual is high, you want to stop the feeding and know why the patient is not digesting this feeding. Oral care is extremely important. Every time you need to move your patient or you had to put them in supine position, you have to stop the feeding for at least 30 minutes before, and so on. So you need to take all these precautions that you learn about as far as safety to prevent the incidence of aspiration. Again, for patients with a chronic disease, especially COPDs and other kind of chronic pulmonary disease, they should stay away from anybody who's has an infection, and of course to take their vaccination. And that's as far as the immunity problems. It's the same thing for all of them. Stay away. Don't abuse using the antibiotics. As far as using corticosteroids, the opportunistic fungal infection, wash the mouth, or mouthwash every time they use it. The vaccinations, if not contraindicated, and so on. So prevention is key in this population. So as far as the management, okay, well, simply if you think of this as an infection, so there's an acute infection, all these symptoms are as a result of infection. So the infection should be eradicated, should be treated, but it may take a couple of days for the antibiotics to start making effect. So meanwhile, we have to manage the symptoms of these patients. So fever, antipyretics such as Tylenol should be the a medication that we can use unless unless contraindicated. Remember, Tylenol can cause liver injury. So if the patient has liver problems, we can give Tylenol. But so the outcomes that we're looking for, the desire is, how do you know that Tylenol works? If the patient's temperature was 104, now you give Tylenol, let's say 650 milligrams every 4 hours or every 6 hours. Then we're looking for normal temperature, for example. Patient has dyspnea. Dyspnea is as a result of decreased the oxygenation in the blood. So if we supply oxygen to the patient, so that should make them ease to breathe. The respiration rate should be within normal. The SpO2 should be within normal. And you will learn next week about the different kind of oxygen modalities and how you decide on using it. Patients is in pain. Again, that's usually because of the continuous coughing or because of patients overusing his muscles. So analgesia could be like aspirin or ibuprofen, and if it's severe enough, we may need to give a stronger medications. But we're looking for patients reporting that the pain is gone. Now that we have active infection, definitely we need to give the antibiotics, and these antibiotics depends on the microorganism or culture on sensitivity or the common microorganism that usually causing this infection, we can just select a broad spectrum. So after we give this medication, if the medication is correct, if the antibiotic is working, is effective, then the symptoms start to subside. Chest X-ray should become normal. The fever and the cough and all the symptoms of infection should go. And again, the patient is fatigued and tired because usually with the shortness of breath and dyspnea, their appetite is low. They don't consume enough. They need more nutrition. So we need to have the patient to rest and also to give nutrition. Now we do not put the patient in complete rest because we want them to also move as they're tolerating, so they can move their secretions. Otherwise, we will have to deal with immobility issues. But we want to give them high iron and high vitamin C's and high protein so they can fight this infection. And that's the outcome we're looking for, is that they have enough energy to fight infection and also do their other activities. So as far as drug therapy, again, we need antibiotics. This antibiotic should be started as soon as possible. You don't want to hold antibiotics just because of the culture. If you are not able to collect the culture within 2 hours, you have to start antibiotic. And you can collect the culture after that, but ideally it should be before. So the kind of antibiotics, again, we will do a broad spectrum and considering the common microorganism that's causing that. Now, for an outpatient patients with pneumonia who is healthy otherwise, we usually prescribe azithromycin or a Z-Pack, 500 milligrams. The first day they take 2 pills of 250, total of 500, and then for 4 days after that they take 1 pill of 250, and I give a refill of another to repeat this course if the symptoms continue, another 500 followed by 4 days of 250. Now for the inpatient, usually if they had to be admitted, they actually they have worse prognosis, so they probably will need more of they need IV antibiotics. So again, depends on the condition of the patient, comorbidities, but a common medication you will see Levaquin, 750 milligrams or 500 milligrams, 250 milligrams, depends on the kidney function of the patient, depends on his weight and so on. Usually give that for 7 days. An alternative, if the infection is sensitive to piperacillin, we can give Zosyn. Zosyn come in 2.25 or 3.75 or 4.5 milligrams grams, not milligrams, IV every 4 to 6 hours, or usually every 6 hours. Now these are the piggybacks of the Levaquin and the Zosyn that you may see in the hospital and you may give. Now for our class, I want you to be ready to look at all these areas as we did last time, and we will have a case study and we will discuss how all these areas and needs of these patients will apply.